Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Our guest in studio today is Dr. Raphael Kellman. Welcome to the program, Dr. Kellman.
Thank you. Thanks so much for having me.
Thank you. You're the founder of the Kellman Center for Integrative and Functional Medicine. Where is the Kellman Center located?
We're in Dead Center, Manhattan, New York City, on 7 West 45th Street.
And is this your only location, or do you have some satellite locations?
Yes. Yeah, no, that's my only location.
And how long has the Kellman Center been in existence?
15, 17 years, yeah.
What services are offered at the Kellman Center for Integrative and Functional Medicine?
We treat a lot of chronic disease, chronic health issues. We treat a lot of unexplained problems, and that's probably the main reason that people come to us after they've been suffering for many years with a wide range of symptoms, and that there's no explanation. They've been to many doctors, and then they find us, and because of a different approach, thank God, invariably we could help them. We also treat patients with various diseases that are identified, but the treatments are only partially effective, and or not effective at all, and they want another adjunctive approach.
You mentioned a different approach being utilized in order to identify problems that had previously gone unidentified. What approach does the Kellman Center adhere to as far as healing?
Well, I use a very systems-oriented approach. Even though, let's say, someone has a lung problem or an autoimmune problem, we're not just addressing the lungs. We're not just addressing the heart. We're not just addressing the autoimmune issue itself as a distinct entity by whether giving a drug or even a supplement. But we look much deeper. Like I always say, we excavate much deeper in two ways. One is to looking for the deeper manifestations of the problem. So in other words, if you look deep, it's not just that they have a positive ANA, a positive rheumatoid factor, or that they have positive anti-TPO, anti-thyroid globulin antibodies as in Hashimoto's, but actually, if you look deeper, you'll see a lot of markers of inflammation to be positive, IL-6, IL-8, TNF. And if you look also deeper, you'll see a lot of issues, a lot of problems in the gut, and especially the microbiome, this incredible, vast ecology of bacteria that are our greatest allies. And you'll see manifestations of these imbalances. And then it's quite obvious that these are the issues that you have to address, the source of the disease, the source of the problem, and to understand that there's no boundaries and there's no walls between organs and systems, and they're vastly interconnected. So here's the example. You have to work on the microbiome. You have to work on the gut and on this very important source of inflammation, even if the patient has no gut symptoms at all. Additionally, if you have neurological issues, whether it's a neurological disease or what we call dyscognition, your memory's not as good, you can't focus, you're tired, etc. And then you're looking into gut function, whether they have a symptom or not in the gut, and then you'll find a lack of integrity and diversity of the microbiome. You'll see deeper markers of inflammation. So it's really looking deeper, and by working on various systems and processes, you begin to connect dots that seem to be unrelated on the surface.
You've got a website, I understand, KellmanCenter.com, is that correct?
That's correct, yes.
Now, when we visit KellmanCenter.com, what would we expect to find there as far as information? And are there ever instances where you refer someone to another facility because of something that you've discovered?
Well, absolutely. Look, first of all, let me answer the second part of the question first. Let's say I have a patient with cancer, and some of them come to me and they don't want chemo, they don't want conventional therapies, but I always refer them to an oncologist. There's one or two that I work with that think out of the box. Well, I should say, like one of them says, he thinks with 1 foot in the box and 1 foot out of the box. And to know how to very wisely use various treatments together, perhaps with a slightly different approach, definitely with a different approach, And it may be a combination of the adjunctive natural therapies with the so-called conventional therapies, but always looking in a different way, looking for the frontier research to better understand how the different therapies can work together. And so that's one thing that we do. But when it comes to many chronic diseases other than cancer, there's so much that we can do from a functional medicine, from this holistic approach, from this new paradigm, that we can help people really recover. We can identify the real source of the problems. We can show people how what they thought were disconnected or unconnected symptoms and diagnoses are really part of a bigger picture, that they have frequently common denominators, and that they begin to see that these symptoms get better concomitantly, and this approach is so effective and so powerful, and it helps so many people that are not being adequately treated and helped from a strict conventional medical approach.
Right. You've been listening to Health Professional Radio. I'm your host, Neal Howard, and we've been in studio with Dr. Raphael Kellman, founder of the Kellman Center for Integrative and Functional Medicine. It's been great having you here with us today, Dr. Kellman.
Thank you. I enjoyed it. Thank you very much.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm